Welcome back to our educational series on human anatomy. Today we're looking at the larynx. Join us as we explore the structure, muscles, arterial supply, nerve innervation, and important clinical relevancies of this vital organ. Before we begin, let's take a closer look at the larynx using a virtual model. The larynx, often referred to as the voice box, is a complex structure located in the neck, just below the pharynx and above the trachea. It plays a crucial role in both speech and respiration. Today we will take a journey from the superior aspect of the larynx, starting at the high weight bone, and work our way down to the trachea.
The primary cartilages of the larynx include the thyroid cartilage, the cricoid cartilage, and the epiglottis. The thyroid cartilage, commonly known as the Adam's apple, provides structural support and protection to the larynx. The cricoid cartilage forms the base of the larynx and provides support for the other cartilages. It helps maintain the patency of the airway. The paired arytenoid cartilages play a crucial role in vocal cord movement by adducting and abducting the vocal cords during phonation and breathing respectively. The paired corniculate cartilages sit on top of the arytenoid cartilages and aid in maintaining the rigidity and stability of the aryepiglottic folds during swallowing. The paired cuneiform cartilages are located within the aryepiglottic folds. These small cartilages provide support and maintain the shape of the folds during phonation and swallowing. From this superior view, we can see the laryngeal cavity. The rima vestibuli is the opening between the vestibular folds. The rima glottidis is the opening between the vocal folds. The shape of the rima glottidis can vary. This has relevance when considering intubation. The glottis includes the vocal folds and processes and the rima glottidis. Let's have a look at the membranes and the ligaments of the larynx. The thyrohyoid membrane connects the thyroid cartilage to the hyoid bone. It helps stabilize the larynx and plays a role in controlling the distance between the hyoid bone and the thyroid cartilage during swallowing. The quadrangular membrane, or the aryepiglottic fold, connects the epiglottis and the arytenoid cartilages. It aids in sealing the laryngeal inlet during swallowing to prevent food and liquids from entering the airway. The cricothyroid membrane connects the cricoid cartilage to the thyroid cartilage. It is an essential landmark for emergency airway procedures, as it is incised during cricothyroidotomy to establish an emergency airway. The vocal ligaments, or the vocal folds, are composed of elastic tissue. These ligaments are responsible for sound production, or phonation. They vibrate as air passes through them, producing sound waves. The cornus elasticus, or the cricovocal membrane, connects the cricoid cartilage to the thyroid cartilage and the vocal ligaments. It forms the lower part of the laryngeal cavity and helps maintain the tension and position of the vocal folds during phonation. Let's look at the muscles of the larynx. The cricothyroid muscle originates at the anterolateral part of the cricoid cartilage. It inserts in the inferior margin and the inferior horn of the thyroid cartilage. Its main action is to stretch and tense the vocal ligaments, resulting in higher pitched voice production. This is the view of the thyroarytenoid muscle. It originates at the lower half of the posterior aspect of the angle of the thyroid laminae and cricothyroid ligament. It inserts in the anterolateral arytenoid surface. Its action is to relax the vocal ligaments, resulting in lower pitched voice production. Here you can view the lateral cricoarytenoid muscle. It originates at the arch of the cricoid cartilage and inserts in the vocal process of the arytenoid cartilage. Its main action is to adduct the vocal folds at the interligamentous portion, closing the rima glottidis and contributing to voice production. Now we're looking at the transverse and oblique arytenoids. It originates at one of the arytenoid cartilages and inserts in the contralateral arytenoid cartilage. Its main action is to adduct the arytenoid cartilages. By adducting the intercartilaginous portion of the vocal folds, it closes the posterior rima glottidis during swallowing and phonation. And lastly, the vocalis muscle. It originates at the lateral surface of the vocal process of the arytenoid cartilage and inserts in the ipsilateral vocal ligament. Its main action is to relax the posterior vocal ligament while maintaining or increasing the tension of the anterior part. Let's talk about the innervation of these muscles. The cricothyroid muscle is the only muscle that is innervated by the external laryngeal nerve from cranial nerve 10. All the other laryngeal muscles are supplied by the inferior laryngeal nerve at the terminal part of the recurrent laryngeal nerve from cranial nerve 10. Now we're going to look at the arterial blood supply of the larynx. The laryngeal arteries branches off the superior and inferior thyroid arteries. The superior laryngeal artery accompanies the internal branch of the superior laryngeal nerve through the thyrohyoid membrane and branches to supply the internal surface of the larynx. The cricothyroid artery, a small branch of the superior thyroid artery, supplies the cricothyroid muscle. The inferior laryngeal artery, a branch of the inferior thyroid artery, accompanies the inferior laryngeal nerve, the terminal part of the recurrent laryngeal nerve, and supplies the mucous membrane and muscles in the inferior part of the larynx. The laryngeal veins accompany the laryngeal arteries. The superior laryngeal vein usually joins the superior thyroid vein, and through it drains into the internal jugular vein. The inferior laryngeal vein joins the inferior thyroid vein, or the venous plexus of veins on the anterior aspect of the trachea, which empties into the left brachiocephalic vein. The laryngeal lymphatic vessels, superior to the vocal folds, accompany the superior laryngeal artery through the thyrohyoid membrane and drain into the superior deep cervical lymph nodes. The lymphatic vessels inferior to the vocal folds drain into the pretracheal or paratracheal lymph nodes, which drain into inferior deep cervical lymph nodes. For surgical considerations, the cricothyrotomy is probably the most extensively used medical technique, involving a small incision in the cricothyroid membrane to establish an airway in life-threatening situations. Nevertheless, the most critical surgical consideration of the laryngeal surgery is the iatrogenic injury to the recurrent laryngeal nerve in thyroid surgery. Usually before and following thyroid surgery, recurrent laryngeal nerve integrity is confirmed by an indirect laryngoscope. Hence, surgeons rely heavily on intraoperative landmarks to identify and evade the recurrent laryngeal nerve. Finally, let's talk about the clinical relevance. Laryngitis is the inflammation of the larynx. It becomes chronic after 3 weeks and is more common than the acute form. Symptoms usually are hoarse voice, pain, and coughing, sometimes depending on the cause, often accompanied by fever. Vocal fold paralysis is a consequence of recurrent laryngeal nerve paralysis. This nerve, as mentioned before, innervates all intrinsic larynx muscles but the cricothyroid muscle. The etiology of recurrent laryngeal nerve paralysis includes a wide variety of diseases, disorders, or causes. Usually, laryngeal cancer is a squamous cell carcinoma and originates in the glottis. Signs and symptoms include hoarseness or any voice change, including vocal fold paralysis, lump in the neck, cough, stridor, or difficulty swallowing. That concludes our in-depth exploration of the larynx. Stay tuned for more educational videos on human anatomy, and don't forget to subscribe to our Dirisana channel for regular updates. This video was partially sponsored by Dirisana Plus, an EU-funded project.